You are evaluating a 50-year-old male complaining of uneasiness in the chest and epigastric region. Uneasiness? Not feeling well. Uneasy means it's not easy. It's not feeling well. The chest and epigastric region in hina. And his wife called 997. On arrival, you see a 50-year-old gentleman sitting on the bed, holding his chest. This is your general first impression or general impression you see. So this is your scenario. Now you are asked to do, your task is 1, perform scene size up. So explain us how do you do scene size up of this patient, this case. Perform initial assessment. We will show you how to do it. We have learned it so many times. Then obtain the chief complaint of the patient. Do you know the chief complaint now? I told you the patient has chest pain. But how will you confirm that chief complaint?
Verbal, by the patient.
Ask the patient. Okay? Whatever it was told to you by radio, it is not chief complaint. It is nature of illness only. But to know the chief complaint, whom will you ask?
The patient.
But it is the same. Nature of illness and chief complaint most of time same. Maybe different also. Because the information given to the radio center may be, call center may be different. When you arrive on the scene, the case may be different. So it may be different, may be same. Then obtain history of present illness. So you have chief complaint, chest pain. So know the history of this present illness. How do you know that? By using what formula?
Sample.
History of present illness, not past. OPQRST. So you ask OPQRST of chest pain. That is history of present illness. And obtain a sample history which stands for other signs and symptoms and all the past and allergic, all those histories.
First OPQRST and then sample.
Sample, yeah.
In case of medical?
Yeah.
Okay.
In trauma, usually there is no OPQRST. There is a rapid head-to-toe exam and sample.
And there will not be trauma patients.
Just for
medical.
This exam, no trauma.
Okay.
But as you go next exam, you will have both.
Okay.
Then finally, obtain a family history and personal habits or personal history. What it contains, family and personal history. For example, any diseases, familial disease like father died of heart attack, or somebody had cancer, or somebody has TB. So this type of family history, family background, plus personal history. What does it mean? Why it is related to the chest pain?
Yeah.
Cigarette smoking. Cigarette smoking.
Alcoholic.
Alcoholism. Alcoholism which went to liver disease. So but habits, do you have any bad habits or any habits like smoking or drinking or something? So you say, I do this every day, or he drink every day, or he smoke every day. So these are the things it comes from. And finally, the last 7th point in this station is display professionalism or professional attributes when you talk to patient, which we had one chapter about it, how to talk to patient professionally.
What chapter was it?
It was therapeutic communications, the first chapter.
First chapter?
9, yeah. How to talk to patient professionally, how to have eye contact, how to stand, how to sit, how to smile. You remember all those points, which we also again re-emphasized during the presentations. During the presentation, we were again talking about the same thing. So this is about station 1. We will practice it now. Once you finish station 1, you will go to station 2. Station 2 is a continuation of station 1.
Yes.
And the same patient, same scenario will be there. Your task in that station is perform a focused physical exam of the patient. Perform a focused physical exam. For example, if your patient's problem is chest, so your main focus will be examination of chest. We will do a detailed exam later, but not now. So perform a focused physical exam. Then you go to obtain vital signs. Here you finish as actually your primary assessment, starting from scene size up till obtaining vital signs, focused physical exam. Here you finish as your primary assessment. Means the primary problem was chest pain, and you address the chest pain, asked all the history, assess the chest, take vitals. So you have a primary set of information now. This is your time to do the necessary management as well. So you summarize your management plan now. So in this patient, what are the treatments or interventions you will do? Like for example, for this patient, what can you do? You will go oxygen. Fantastic. What else?
Maybe nitroglycerin.
Nitroglycerin tablet. What else? To give nitroglycerin, what you should know? Your blood pressure. Very good. What else? Nitroglycerin, oxygen, nitroglycerin. What else?
IV maybe the blood pressure from.
Okay, just establish an IV line. Very good. No. No need.
Medical.
Transport? Okay, transport. We are already on the way. Once you finish your initial assessment, patient is already in the ambulance. What to do with aspirin? Okay, the treatment for this station is not very much concentrated because you have not been introduced well to the treatment part. So, however, you know you need to do reassurance or not. Which one is reassurance?
تأكيد.
Means you will be all right and you are in good hands. We will take care of you. So this type of reassuring words to patient. Patient says, "I'm comfortable sitting like this." So what will you do? Put him in his comfortable position to breathe. So comfortable position. So starting with immediate transport, high flow oxygen, nitroglycerin, aspirin, reassurance, comfortable position. All these things are basic management. As we go to next semester, when we learn cardiology, we will go to advanced management of this patient. So summarize the basic management which you know. Clear? So the last is 2 points remaining. Now it depends upon your transport time. If your transport time is very closer, what you will directly go to? Which assessment? Very closer, maybe 10 minutes to go.
Vital sign.
Vital sign, khalas. You will repeat vital signs every 5 minutes. That is called
Ongoing
assessment. So if the transport time is very, very shorter, you will directly go to ongoing assessment every 10 minutes or 5 minutes?
5 minutes.
Chest pain.
5 minutes. Critical.
So every chest pain, abdominal pain, breathing difficulty, always consider as
5 minutes.
Critical.
serious patients. Abdominal pain, acute abdomen, chest pain, difficulty breathing or shortness of breath, consider as serious patients.
Critical.
Every 5 minutes.
5 minutes.
Your transport time is half an hour. What could you do? You are sitting free. Every 5 minutes ongoing, otherwise you are free. What to do? Do a detailed physical examination. Clear. So if you have enough transportation time, now you start. However, even though the patient's chest is affected, but there could be something else present in the patient, which patient is not complaining. So what you do is examine from the head and nose and ear and all the parts of the body, starting from here, palpate the abdomen, check the pelvis, check. Because why you are doing detailed physical exam? What's the idea behind it?
Hidden injuries.
Some hidden illness or injuries which patient was not complaining, which came out while you doing the detailed physical exam. And finally, ongoing exam. This is the plan for station 2. So starting with incisor, ending with ongoing exam. This is the patient assessment complete sheets. The assessment will be done by this sheet, medical assessment sheet. The history taking, I will copy this part of it, history taking, to a different page. Same thing. Only addition here will be family and personal history. What is the only addition here?
Family and
in sample history, as you finish sample, family and personal history. And I will also add 1 point for professionalism. One grading, yeah. Something like this, but I will edit this. This is not completely correct. I will just modify this. Okay?